Now with us is Kristen Harrington, physical therapist who specializes in pregnancy and postpartum rehabilitation. Kristen, thank you for being with us.
Thank you for having us.
Let's learn about pregnancy and postpartum rehabilitation. And again, for those who may hear about these things but aren't quite sure what it is that therapy offers.
Yeah. So I am a physical therapist trained, so I have an orthopedic background, but I've also done training in pelvic floor therapy, and then I've also done training in specifically for pregnancy and postpartum women. They have like their own challenges as they're kind of either going through pregnancy or recovering. So my training is kind of geared towards helping them to navigate that. So we do kind of look at orthopedic problems, so it could be a pregnant woman coming in with back pain. Her back pain is going to be slightly different than somebody that's not pregnant. And then I kind of see them through the whole span, preparing them for labor, delivery, what to expect from early postpartum recovery when they're more home with the baby and taking care of a newborn versus coming in for a reassessment at postpartum and really helping them re-coordinate muscles that didn't work properly while they were pregnant.
So whether it's somebody's first child or their third or fourth child, each pregnancy is different.
Absolutely, absolutely.
So maybe let's go back and talk specifically about some of the things that may be occurring over the course of pregnancy where somebody might say, yeah, I should see you.
Yeah, definitely. There's just this preconception that with pregnancy you're going to have aches and pains and you're going to have pressure and things that just don't feel normal to you. And we kind of chop that up to like our body's changing, like we're growing a child, we're putting on weight, but those really can be addressed. An orthopedic problem can be an orthopedic problem before you get pregnant, and it can be exacerbated by pregnancy. So I do see women that just come in and say, I'm having terrible back pain. So we work through that. Women that come in, maybe it's not with their first child, but with their third child, they're just having so much pressure in their lower abdomen. There's things that we can do to alleviate that. They don't need to be miserable for a whole pregnancy and wait until delivery happens to feel better.
And then there's childbirth, and then everybody gets sent home.
Yes.
And then afterwards.
Yes.
Sometimes that part's forgotten. A lot of times I would imagine that's forgotten.
That is. And again, there's this idea that, well, we had a baby, so there's things that we just have to get through or it'll improve eventually. But really in pregnancy, our abdominal muscles and our pelvic floor muscles specifically don't function properly. So they're put through a lot of stress and they do need retraining. There can be women that are 5 years postpartum and they never got those muscles to re-coordinate and retrain, and they still have problems because of it. So if we can catch it early on and get them trained properly, then they could avoid those long-term problems.
Is it something where it's better to catch it afterwards, or what if somebody even 10 years later is saying, yeah, I never really got through that? Yeah,
definitely. So if you catch it early on, then it's going to be a little bit more just related to pregnancy, right? And related to delivery. Whereas 10 years later, it's kind of evolved, right? It could be more of a problem that's a long-standing issue with muscle weakness, and it could be a little bit more challenging to kind of get back from, but that doesn't mean that we couldn't address it as well.
Do you see patients who maybe pregnancy has nothing to do with issues that are going on, but they still are coming to see you?
Absolutely. So Erin and I, who's the other pelvic floor therapist, we treat women with all pelvic floor conditions. So sometimes we don't think that they were related to postpartum, but they could have been. It could have been just, again, age, postpartum, post-surgical, all of those things that can kind of develop into a problem 5 years down the road.
We live in an area where I think people grew up, and it was if you got hurt, it was, hey, suck it up, get back into the game type thing. And it's such a variety of people, right? We're proud to be tough here in Northwest Pennsylvania. And you may be seeing somebody who works hard on a farm, maybe in the tool and die shop, maybe just sitting at the office. It's a span of people. Is every day a little different for you? Is every patient different?
Oh yeah, and that's what I love. So it's a lot of problem solving. It's a lot of being super specific for that patient, right? So there's ideas and thoughts that I go through with every patient, kind of a similar evaluation, but I love kind of diving in and really problem solving, like what's going on with them? Is it really related to this hip that's bothering them, or is it kind of somewhere else in their body and that's just what's talking to us? So it's fun, even in pregnancy, kind of working through that postpartum, even just my pelvic floor specific patients. Like I kind of look at the whole body because there isn't just one thing that's happening in your daily life.
Would you say patients know this is available, or is this concept new to a lot of people?
I think it is pretty new. I also think it's a topic that isn't really widely talked about. Some of the symptoms that women have, either pregnancy, postpartum, pelvic floor, isn't really dinner conversation, right? So we're not kind of just discussing it with our friends and our family that we're having these specific symptoms. And so we kind of brush it aside. Maybe we'll bring it up at a doctor's appointment, maybe not, but we kind of just live with it. But it can be something that can be worked on, and it needs to be known that it can be addressed, especially to your physician. Like you don't need to just brush it under the rug.
It's amazing to me, and again, just learning from all the guests we've had, while something may be embarrassing to talk about at the dinner table, shouldn't be embarrassing to talk to your doctor about.
Right, absolutely, yes.
So don't be afraid to have those conversations. And one of the things we learned was it's okay to maybe contact your office and get that support, and here's what you can say to your primary care physician so you can be referred to us.
Correct, yes. And that's specifically for my pregnancy patients. Have that conversation with your doctor. Be like, I know I have back pain and I know I'm pregnant and it might just come with the course, but is there a therapist that I could go and see and just get an evaluation to see if I can feel a little bit better? Because it is making A, B, and C part of my life challenging. Same thing with postpartum. At that 6-week follow-up appointment, mention it. Be like, I've heard that it's really beneficial to go to a pelvic floor therapist. Is this something that you could help me figure out?
When did you know you wanted to get into this field?
Yeah, so physical therapy, I was in sports as a youth, so I knew that that was something that was interesting to me. And I really enjoyed my work as a physical therapist in the transitional care unit, the rehab unit, and then I had kids. And so I actually got thrown into pregnancy and postpartum and realized I didn't know a lot about how to recover myself. And so as a physical therapist, trying to navigate back pain during pregnancy and the symptoms I was having postpartum, I realized there's probably a lot of people out there that also don't know what to do. And so I decided to do the training to, number one, help myself, but then to help everybody else.
Did you know that that specialty existed?
Well, I knew of it because of working with Erin closely. We're in the same building, and she was treating women. But then I realized that it is something that's kind of overlooked. As a first-time mom, there was a lot of unknowns, and I feel like I can help women kind of navigate my area in that.
What sports did you play?
I played soccer all year.
All year. What position?
Midfield and defender.
So it's great to hear those stories where, you know, things that you've done in life kind of impact your career. What's it been like for you to work at Meadville Medical Center with the staff and just the community?
Yeah. I love it here. I love the team camaraderie that we have, the family sense. I drive a distance to come every day, and everybody always asks me, don't you want to work a little closer to home? Don't you hate the drive? Well, I do, but I love the people I work with, so I'm not willing to give that up. So I love what I'm doing, and I love the program that we're developing and the patients that I get to treat, so I'm happy and content.
Any hobbies outside of work?
Well, I have 2 little ones, so they keep me pretty busy. We're always outside doing things and exploring and trying to travel and do different experiences.
Any future soccer players there?
We're trying. We're trying different sports. Swimming, soccer. We're getting there.
All right. Kristen, thank you for all the great information.
Thank you for having me.
And again, you can find out more about Kristen's specialty by visiting mmchs.org.